COVID-19 has spread around the world, it has had major impacts on supply chains. It's reasonable to assume that the impact on trade will be at least that of the global financial crisis in 2009, when flows fell by over 20%. Some of this is the natural result of the closure of many factories around the world, but some of it is the result of direct government interventions, which could imply a more long-term and major impact from the current crisis. Even before COVID-19, companies were dealing with a rise in protectionism, which was unprecedented in the modern era. Over the last few years, with my colleague Jappe Eckert in the University of York, we've been looking at company responses to this challenge. We found that, at least in Europe, many companies were quite complacent. Their trade associations were worried, but busy executives often considered that protectionism was just rhetoric and that it would never happen. And yet we've seen a major trade war, and there's rising concern about the future of the World Trade Organization. This has undermined the foundations on which many companies have spread their production around the world. Now COVID-19 has hit on top of this context. It has resulted in rising government interventions to protect the production and supply of key goods, especially in the healthcare sector. So we've seen India restrict the export of pharmaceutical compounds and the US protective masks. These are not isolated incidents. The International Trade Centre's figures indicate that almost 90 countries have taken similar measures. These are contrary not just to WTO commitments, but also to the World Bank advice to countries on how to use trade policy to address the pandemic. Any defense would rest on the idea that they are necessary to protect human health or security. And indeed, one impact of COVID could be a reassessment of the long-held idea that strategic industries are mainly those related to defense and security. There is likely to be a rising concern about regional and national self-sufficiency in these industries. This may be desirable, not least for environmental reasons, but many millions of vulnerable workers in the developing world are dependent on trade openness for their livelihoods. They face not just the immediate hardship caused by a major reduction in demand for goods because of the pandemic, but also the more long-term prospect of a more protectionist world post-COVID, which will close off many of the avenues for them to climb out of the crisis. Finally, these direct interventions to restrict the supply of vital health-related goods are likely to damage relations going forward, literally endangering the lives of the citizens of supposed allies and developing countries during a crisis which we all face together will undermine future bilateral and multilateral relationships as we move forward and maybe for decades to come. The one thing I am sure of is that international relations will never be quite the same after COVID, and that companies will need to deal with the fallout from that new reality. The new normal will be even less business as usual than the last one was.